My name is Melissa, and I am a medical and molecular researcher here at JCU Cairns, and I'm studying jellyfish venoms. We're really dedicated to this research because jellyfish envenomations not only have an impact on far north Queensland's public health, but they also have an impact on recreation and tourism. It doesn't affect just far north Queensland, it actually affects Northern Territory and Western Australia, and it's really a global problem. There are cases of severe jellyfish envenomations ending in fatality in places like Malaysia and Vietnam as well, so it's a bit of a global problem. Our particular focus is on the fatal box jellyfish antivenom. We are looking to understand how it interacts with human physiology, and the reason we are doing that is because the current treatments for severe envenomation are first aid, pain relief, and opioids and antivenom. And the reason that we want to look at this is because they're more consensus-based treatments rather than evidence-based treatments, and there's been a long-standing question in the community of if the treatments are effective. So our research will be conducted with a lab in JCU Cairns that's based in immunology, and we're specifically looking at how the antivenom performs in human physiology cases. And we also want to have a look at some other more neurological experiments as well. So all of our stuff will be done in vitro, so we'll be working in dishes with human blood serum and the antivenom and the toxin. That's what we're going to be attempting for the first time, so we're going to use some technology called mass spec to kind of look at how these three over time perform. And so it will show you the products of, in the human blood serum, it'll show you the products of the venom and the antivenom, and we're going to see how they are actually performing over time, and if there's a reason that that the treatment is not very effective. The closest thing I can think of is actually several studies have tried pre-mixing antivenom and venom before using it in mouse models, and they have, for the most part, if it has been pre-mixed, they have found that it is effective, but it doesn't translate very well to clinic because nobody's gonna have a pre-mixture of antivenom in their body before they may or may not get a sting by going out and visiting the beach. So we're definitely looking for something that is more applicable to, clinical application. We actually have several samples of jellyfish venom, and it's a really good idea to, when you find something with one sample, to go to another sample of venom and just triple check that you see the repeatable results somewhere else. And then of course everything will be run in at minimum triplicate, and there will be extensive statistics that help support what you found is actually reproducible and it's real. This research really helps. It really is aiming to attempt to shed light on the mechanistic knowledge of these venoms so that we can have better improved treatment for box jellyfish severe envenomings. These are the jellyfish that cause fatalities, but there's also further potential for venom-derived pharmaceuticals. There's further potential for better understanding of molecular pain pathways, and there's also, the hope would be one day we would learn something about it so that we could have an antivenom for irukandji envenomation. And irukandji syndrome is very prevalent in far north Queensland, and there's currently not an antivenom available. I did a bachelor's degree in biochemistry, and straight out of the gate I went and worked at a pain clinic where patients were cycling on and off pain treatments such as opioids, opioid pumps. These people had chronic pain, it was never going away, and it was so heartbreaking to see these people plan their day around 5 milligrams of oxycodone that when I decided to go into research, I had an idea that I wanted to start somewhere in pain. And as an undergraduate student, that's broad. That's really broad. So with my advisory team, I was able to find a project that had some overlap with it. And the overlap is that jellyfish venoms cause systemic pain, all of them. They cause system-wide response to the venom. It's not just at the contact site, and especially for irukandji syndrome, there is additional response, such as the respiratory response, the cardiotoxicity, the parasympathetic dysautonomia. That just means you start having mental hallucinations. If you've ever known anyone with irukandji syndrome, you would hear that it's a lot more than just the physical pain. There's other stuff going on as well. And so that's somehow how I linked to jellyfish venom. Was I was in a pain clinic for a year, and it really was heartbreaking watching those people, and it kind of bridged me to studying jellyfish venoms. Thank you again to the Far North Queensland Hospital Foundation.